Good morning, TGIF. It is Friday, March 3rd. I'm Alexis Delcid in for Jessica Lovell. Welcome to the Morning Medical Update. Sometimes we try to power through the pain. You think maybe it'll go away, maybe the problem might fix itself. But what happens when the pain and agony becomes so extreme you can't even stand up? Today we're meeting a man who lived it, and you'll see the treatment that stopped his suffering. But first, let's jump in with morning rounds. We have cardiologist Dr. Shannon Hoos-Thompson here to help us understand some of the headlines you might have seen this week, in particular about artificial sweeteners, because there is a study published in the journal Nature Medicine that has linked erythritol to an increased risk of blood clots, heart attacks, and stroke. Erythritol is often used as a low-calorie sugar substitute, or you'll often look in the ingredients and see it mixed in with your sugar substitutes. Makes it popular for weight loss, diabetes, if you're trying to cut down on sugar, or maybe you're on the keto diet. We want to clarify two things before we go to Dr. Hoos-Thompson. One, we're talking about a link between the sweetener and blood clots. It's too early to say if one thing causes the other. And two, Dr. Hoos-Thompson, you were not directly involved in this research. But that being said, I love it when you come talk to us because there are so many headlines and health studies that come at us on a daily basis, so it can be tough to pick out which ones are important. How does this one weigh for you on the importance scale?
So I would say this is a good study on the importance scale as far as it's well done science, because way too often things get published that were not well performed studies. So I think this was a well performed study, so there is some merit to what they're getting at.
Is there enough evidence from what you have seen to justify switching to a different sweetener? I read a few of these stories in a row about this, and I went home and threw mine. I just threw it all out. So I know I'm on the extreme. What's your take on this?
Yeah, so this is well proven to be safe to consume. So you can consume sweetener and do it very safely on a regular basis. That being said, what this study did is looked at, okay, a spot check in people who already have established risk factors for cardiovascular disease that may or may not be well controlled. And then we looked at them over about 3 years, saw that, hey, people were in that highest quartile. So it wasn't just people who consumed it, but people had really high levels of it when they checked it that one time. Over time did show signs that they were more prone to cardiovascular events like strokes or heart attacks.
So this is for people who are in those high risk categories. What about healthy people, young people who are perfectly healthy? Should they also pay attention to something like this?
So how you become high risk is not doing a good job of taking yourself early on in life. And we see that in younger and younger ages. So making good decisions about healthier diets or balanced diets, it doesn't mean you can't have these things, but everything in moderations, or pay attention that when in doubt, choose your fresh apple, not your apple substitute or whatever you're picking. So can you have those sweets? The answer is yes. Can you have those sweeteners? The answer is yes. But over time, can they set you up for bigger issues? The answer is yes there too. So you just have to pay attention and be aware, and that's through your whole life.
And then I want to ask a specific question, just because all my friends have been texting me when I said you were going to be on about this topic. They said, well, what about my one packet in my coffee in the morning? Can I do that every day? I've gotten that question in different forms from probably a dozen different people.
So the answer is yes, if that's when you're using it, and very clear, but just knows that it's in more and more foods as we use more and more processed foods. So again, fresh fruits and vegetables are always the foundation, and less processed food is a good thing. But if you are indulging, which I do, with the sweetener in your coffee on a regular basis, that's not going to set you up for big bad things. It's really a lot of other things in a combination, especially when you do it on a more massive scale.
Can we put the voice of reason on your business card? Because I feel like you are the voice of reason. I need to call you before I make drastic decisions, like throwing out all my stuff.
Well, we talk about times to indulge and times to pull back, and there's opportunities for both as we go through our days and go through our lives. So I hope you do both. Don't be afraid to enjoy things. That being said, you can't overindulge.
Thank you, Dr. Hoos-Thompson. We appreciate your insight and when you give us clarity on these issues. Have a great Friday. Now to the man you're about to meet, who was enjoying retirement until leg pain so severe stopped him from doing anything he enjoyed, until he found the vascular center here at the health system and a doctor that was finally able to diagnose him and get him back to living.
We started with 2, now we've got about 100.
I love my fish pond.
After a season of health problems, Ron Kimes is back.
I'm in the best shape that I've been in the last 3 years.
And if you spend an afternoon with Ron and his wife Deanna at their Ottawa property, two things are clear. One, they adore each other. And two, after more than 60 years together, they have some great stories.
I'm a year and a half older than Ron. So when he came to school, I was a junior and he was a freshman. And he said, "How does an underclassman get a date with an upperclassman around here?" And I just looked at him very firmly and I said, "They don't."
And that was when I threw the gloves down and said, the challenge has been given.
Building a full life doesn't come without the occasional speed bump, like the time Ron cut off his finger making a birdhouse for their daughter, and Deanna was ordered to find it.
And the first thing I said was, I cut off my finger.
She said, no, go out in the garage and look for his finger. I said, "Are you kidding me?"
Or recently when Ron wiped out on his bike.
I got on my bicycle. She wasn't home.
But in the summer of 2021, Ron got hit with something that all but leveled him.
I started having pains in my in this leg, a lot of pain, and it just wouldn't go away, and it just sometimes it'd be unbearable.
A pain so searing, at times Ron could barely stand or even sit up. His doctors were stumped. Deanna was worried sick, until Ron was finally sent to the University of Kansas Health System's Center for Advanced Vascular Care, where they met Dr. Axel Thors.
We had so much confidence in Dr. Thor, and he was just so great and so personable.
Dr. Thors is one of a kind.
Dr. Thors diagnosed Ron with peripheral artery disease, a condition that restricts blood flow to his legs. He also had a plan, but ultimately it would take 3 surgeries, one in Ron's neck.
And it was a short time between this and this.
Deanna was incredibly nervous, but she had to put it all aside and trust that Dr. Thors would restore life to the cutest underclassman she'd ever met. We are so happy to have Ron here with us this morning. Great to see you. Love your Royals getup. How are you feeling?
I'm feeling as good as I could feel at this time.
Oh, well, it's good to see you again. And sitting right next to me in the Dolph C. Simons Jr. Family Broadcast Studio is vascular surgeon Dr. Axel Thors. Ron and his wife Deanna just adore you, so I'm so glad to have you all on the show. And Ron, you looked like you were moving really well in that story. I understand you had another procedure about a week ago?
A week ago today, yes. Yeah.
And how many procedures? Oh, go on.
This is the 4th procedure that I've had. Each leg, the right carotid artery, and now the left carotid artery, and so it's doing well. I've been given a go, so I'm doing well considering what I've been through recently. But again, like I said, I feel better than I have in many years. I want to bring Dr. Thors in, because Dr. Thors, you really gave Ron and then Deanna through Ron their lives back, and they're able to enjoy so much more. Why would you need to do all separate procedures? Could you do them all at once, or would that be too much?
It would be too much to tackle all of these things all at once.
Yeah.
You know, this is a perfect example of how this disease affects multiple areas in your body while being the same disease. And so it's always a better idea to tackle them individually if you're able to.
One of the things that Ron was talking about was how he was able to go in and get this done, and it was a procedure rather than the surgery of cutting someone open. Can you explain how you're able to do that so differently in the vascular center?
Sure. Well, for Ron's legs, for example, that is an outpatient procedure where we can go in and revascularize the legs through a minimally invasive fashion, so that the patient comes in, has the procedure, and is able to go home the same day. And it involves multiple technologies, so every treatment is a little bit different.
And as we're talking about this, we have an animation that we can pull up, so you can kind of talk us through this. For peripheral artery disease. Is this what you did with Ron?
Yes, this is one of the procedures that I did with Ron, and as depicted here, you can see the animation of the inside of a blood vessel, and this is a device called an atherectomy device that reshapes or remodels the inside of the artery by removing layers of plaque, as you can see depicted there. It has a cutting wheel that removes the plaque with certain layers, and that allows us to be able to have what's called compliance of the vessel, and then we can treat it with other modalities if necessary. Again, this is all plumbing, so we are rerouting or reopening clogged pipes to bring blood to where it needs to go and relieve symptoms clearly.
Well, Ron calls it the Roto-Rooter.
That's right. That's really what.
Is that how you kind of explain it with plumbing analogies to people? So what happens to all that stuff that the plaque you're scraping away after it gets removed from the walls?
Yeah, as depicted in the animation, the plaque enters into the nose cone of the device, so it's captured. And many times we will have what's called an embolic protection device, which is a filter beyond the device that we use to treat the vessel. So it also acts like a catcher's mitt to catch any debris.
I have kind of a strange question, but what does it feel like? Is it hard? Is it sticky?
It can be both. Most of the time, plaque is hard. You hear about hardening of the arteries. This is a perfect example of that.
So it's truly as hard and
it's hard as a
crumbly?
rock.
Wow.
Yep.
So you really do have to go in there and scrape it, kind of get it out.
Yes.
You've brought some before and after images as well of peripheral artery disease, and we have them. These are fantastic. They're pulled up on the screen here. Which is before and which is after?
The image here is before, and you can see this is a blood vessel. This is how it looks on an angiogram image, and you can see a clear discrepancy where there's no flow in a certain segment, and that's the lower segment there.
And then here you can it's like a clear pipe.
That's right. So this is before and after, and clearly we have reestablished the flow through the pipes through these different modalities.
Is that the same before and after? The same part of the body?
Different
here?
location.
Okay.
This is the foot, so you can see the ankle bone down at the bottom end of the foot. And you can also see an example of all of these vessels here at the ankle, which we call collaterals. And then after revascularization, you can see the blood flow going into the two main arteries at the ankle and the foot where they're supposed to go.
Right, there's nothing on that side, and then you can see it clearly here.
Yes.
That's remarkable. So that's what Ron looked like before and after.
Correct.
In his legs and in his carotid.
Carotid artery is very similar.
Well?
However, we can do minimally invasive treatments for Ron. He had surgery to address the plaque in his carotid arteries, and that's where we physically remove the plaque out of the arteries. And here at the University of Kansas Medical Center, we do that under local anesthesia typically. Patients are generally awake and do very well with that.
So you did cut to go into his carotid arteries so up here, so there it was a procedure, and up here it was you had to get in there and open it up.
Yep.
Ron, I want to ask you about your recovery. One of the things you've talked about is how it was stressful to have to lie as still as possible for a period of time. How long did you have to be real still?
Well, that was for the legs. And I forget, Doc maybe tell us, but I thought it was like 3 or 4 hours.
And you just had to not move a muscle? You're laying on your back?
Yeah. And once that was okay, once the go was given, we went home. It was that simple, but once I came out and was laying in the recovery room, it was like, okay, you've got to stay still on your back. You can't get up. You can't get out of the bed. You just have to lay there. And so in doing so, it didn't seem like it was long. I thought, man, this is going to be forever. But the time went by quickly. Of course, Deanna was in there with me, and we conversed and had, talking and so forth. So when it was all said and done, I was good to go, and that happened each time on each leg.
Why do they have to lie still like that?
Yeah, the time period, I can clarify that. It's generally about an hour. And the reason is we're accessing the artery. We're making a hole in the artery, placing essentially the equivalent of a small straw on the inside of the vessel in order to gain access and treatment. And so we place typically what's called a closure device to close the hole. But if you get up immediately after that procedure, because the artery is under very high pressure, you can disrupt that closure device and have bleeding. So typically about an hour of bed rest.
Well, that's not bad, an hour.
Not horrible.
Were there any other restrictions for you, Ron, once you were out of the clinic, out of the hospital, and back to your world with Deanna?
Not that I can remember. You know, it's been several months ago, and so I can't, I don't think there were any restrictions, not as much as on my carotid artery.
And what are the restrictions after this most recent surgery on your carotid artery?
One, until I could use my neck both ways, I couldn't drive. I couldn't lift 20 pounds. I had to keep it clean. I could shower, and as of today, as I had a conversation with Dr. Thors, I don't have to use a patch over it anymore. I can just leave it, and as the strips come off, I will be really good to go because everything else has come together. And I feel fine. I feel fine.
Oh, it's the best thing to hear. One of the great things about having you and having our doctors on this program is we get live questions and comments, and I'm already seeing some come across on my phone, so we'll get to those in a minute. But if you have questions or comments, any messages you want to send to Ron and Deanna, you can reach us live on YouTube, Facebook, and at the Medical News Network email. The links are right there on your screen. We'll get to those in a moment. We want to check in with our COVID count from Dr. Dana Hawkinson right now. He's the Medical Director of Infection Prevention and Control. Good morning, Dr. Hawkinson.
Hi. Yeah, COVID count right now going pretty well, a little bit better than the last couple days as far as active infections. 61 total, 26 active infections. Really, that has kind of been our plateau, where we have been for the most part the past couple months, really. Of those, 4 in the ICU and 2 on the ventilator. So.
Want to ask you about a headline that recently came across for us on the news. Flu and COVID combo shots won't come in time for this year. That's what the FDA says. Dr. Hawkinson, there are COVID shots, flu shots, soon there could be RSV shots. So suddenly this yearly vaccine schedule is getting kind of packed. Do you have thoughts on that and what we could see in the future?
I mean, we know about the COVID fatigue, the pandemic fatigue, you know, vaccine fatigue, certainly, but if you are in those high-risk categories, meaning you are at greatest risk of hospitalization and severe disease from these illnesses, it is very important to continue to stay up to date with those vaccines. Obviously, it's easier if they're all in one vaccine shot. That is not the case at this point in time, but you can get them on the same day, so that is good. And you know, we really are trying to protect, again, especially those most at risk, as we go into the next respiratory viral season, which includes RSV, influenza, probably COVID. We know COVID does have some baseline, SARS-CoV-2 does have some baseline transmission throughout the year. And other seasonal respiratory viruses, it's going to be vitally important to protect yourself as much as you can. Getting and staying up to date with those shots is the most important. It would be easier if there was one. At this point, there isn't. So we'll just have to see what the final recommendations are in the forthcoming season, which probably we'll know more about it in July or August on when to get which vaccines as well. But I can understand people's concern and just the fatigue over this. But these vaccines are safe, and they do help protect you against going to the hospital and, of course, having severe illness.
Thank you, Dr. Hawkinson. Want to check in with our reporters to see if we have any reporters on the line today with questions. Looks like we are good right now, so let's get to our comments and questions. from the community. First of all, I have a comment that just came in. Ron, this is for you and Deanna from Georgianne. Amazing story of the attractive couple. I wish Ron and his wife the best. Fascinating procedure for plaque removal. Ron, where is Deanna right now? Is she still sleeping?
I don't know where she is. I can call for her.
We will want a cameo. If she's around and she happens to feel like being on TV, you can have her pop in and say hi, which brings us to actually Sherry. Sherry wants to know how Deanna is doing. We saw her in the story, but not on the show. So Deanna's doing her own thing, but she's there.
Deanna is one who really takes care of herself. I mean, she does. She walks every day, and she's very conscious of her health, and she's very conscious of my health. And so I have a good helpmeet to see me through some of these things, and she's been a blessing. She's been a real blessing.
You guys are a very good team. That's clear from anyone who spends just 5 minutes in the same room with you. Isabella has a question. She would like to know, Dr. Thors, when plaque causes a blockage, how does that lead to the pain? And why does the pain get worse over time?
Sure. The blood vessels are trying to supply blood to muscles typically, and so if the muscles cannot receive the nutrients and blood flow that they need, it produces pain. So when somebody walks for a certain distance, they might get a certain element of pain. If they stop and rest, the blood is able to catch up and get to that point eventually if their blockage is not significant. But when you improve the blood flow in the arteries, that muscle group that is causing pain can no longer hurts because it's getting the nutrients that it needs.
Yvonne has a question. She wants to know what causes the plaque to build up in the first place, and how long does it take for that buildup to happen?
This plaque is atherosclerosis, hardening of the artery. So the risk factors for that would be the high blood pressure, high cholesterol, diabetes, family history, not enough exercise, many things that contribute to this. And typically this accumulates over our entire lifetime. So it's not one event. There can be some other conditions that can happen as an emergency, but that's not the nature of what we've been talking about this morning.
Jenny wants to know if there's a test that you can do preemptively for this to know if this is starting to happen in your body.
Yeah, if you have the risk factors for this, then there are non-invasive tests that we can do in our office. One of the most common tests that we recommend is called an ankle brachial index, and that's just measuring the blood pressure in your arm and measuring the blood pressure in your legs, and that gives us a ratio of the percentage of blood flow in your legs and can lead us down the road of treating this.
Jeremy has a question on Facebook. Are there any areas of the body that are more prone to this happening, or could it happen anywhere in your body?
It can happen anywhere in the body. Like I said, all the blood vessels in your body are not unique. They're just different sizes supplying different locations. So it literally is like plumbing to your house. It's plumbing to your body. And that's why it is so important for all of us to take care of ourselves, to not smoke, to take our diseases seriously, to not just assume that our doctors are going to take care of everything. We have the ownership in our disease, and we should be on top of those things to prevent these conditions like atherosclerosis from getting worse as we age.
Now, in Ron's case, Ron is so active and so healthy and really takes care of himself. So is it just bad luck in some cases where you just get older and stuff builds up?
It can be, and you can have some genetic predisposition to these types of diseases. But like we mentioned, Ron does have some risk factors that made these things occur in his body. And every person's situation is a little bit different, but most of the risk factors are fairly similar, with that said.
I have a quick question for Dr. Hawkinson. I have a COVID question from Ruth Allen. Yeah. Ruth writes in, Our last vaccine was in September. Will we not need another until August or September of the following year? We both now have COVID, doing okay on day 4, thank goodness for the vaccines.
Yeah, no, you're absolutely right. You know, there has been no further recommendation after that initial bivalent booster recommendation. The FDA has sought to simplify everything, so it is looking like it's going to be more of the once a year up-to-date booster vaccination for COVID-19, just as there is the once-a-year influenza vaccine. That is the latest information that we are all expecting to hear and get those final recommendations in August or September. But you're absolutely right. There's just been that recommendation for that first bivalent vaccine. Nothing until probably next respiratory viral season, again, which we start vaccinating in usually August or September for that.
Okay. Ruth Ellen, so sorry you both have COVID.
Yeah.
At least you're in it together, and hopefully it doesn't get any worse than whatever you've experienced now, and you have some good Netflix shows to watch.
Yeah.
Yvonne has a question. Well, we just asked Yvonne's question. Tom wants to know, are patients asleep during the procedure, or are they awake and talking?
So depends on the procedure we're talking about. Both of the procedures, both the carotid surgery that we talked about, as well as the lower extremity intervention that Ron had, you're generally awake. You're under a light sedative for those procedures, so not completely asleep.
Ron, do you remember what it felt like?
Well, yeah, a couple of times I had to say, "Whoa, you know, that's hurting," and then it was okay. And Dr. Thors would give me an update as we're going along. Okay, we're at this stage, or we're almost done, Ron. But I was hearing everything. I was aware of everything going on, so I just could feel what was going on. Not so much the pain issue, but with the hands and everything working on me. I felt that, but not to where it was so painful that I couldn't stand it. It was okay.
Kind of like when you're at the dentist and you can hear the drilling and hear the sounds. That almost is like an anticipatory pain, where you're like, oh, that sounds weird. You can hear it and feel the pressure, but not too bad.
Right. That's the way it was. That's the way it was. Yes.
I want to bring our whole panel back in for some final thoughts on this. And Ron, I want to start with you, because one of the big takeaways after meeting you and Deanna is just how relieved you were to finally reach Dr. Thors and become his patient.
Well, my doctor said that, you know, we got to do something. They'd done some tests and everything, and I can't remember how my doctor's office got hold of Dr. Thors, but I'm telling you, I'm glad that was the direction that they took me, because I have I have a life back again. I did a year ago. It was a year ago, January 14th, I think, that I had my carotid artery done on my right side. And now a year later, I have it on the left. And so I've got both extremities on my legs, both sides of my neck. I told him this morning, I said, there's nothing else to do. So let's just move on. I'm ready to move on.
You must love hearing that, Dr. Thors.
Absolutely. No, Ron has done very well, and it's the greatest satisfaction for us as providers to help our patients get through tough times and use appropriate technology and research and all of the things that we have spent a lot of time learning to help our patients. So,
Dr. Hawkinson, you have any final thoughts as we head into a weekend?
Yeah, I mean, I think these questions were good. Again, we are continuing to see new things about COVID-19. Hopefully it is impacting our lives less and less individually, but also as a community. We are certainly working for that. The best thing you can do to protect yourself as an individual and the ones you love is remember to stay up to date with vaccines. We are looking forward to any new recommendations for COVID-19 boosters as they come along, probably in the next 6 months or so. But also any other vaccine updates that may be coming. We know RSV vaccines are coming for the elderly. That is an important thing to help keep people out of the hospital as well. So it's exciting, and there's a lot of things to look forward to in the next year or so.
Thank you so much to our doctors and to our guest, Ron. Give Deanna a hug from us. And thank you to our viewers for being with us today. We appreciate you. We will see you back here Monday at 8 a.m. Have a great weekend.
Coming up Monday on the Morning Medical Update. From a life-changing diagnosis to ringing the bell, one colon cancer survivor got huge support from nurses, neighbors, and even the Chiefs. I'm Jessica Lovell on the next Morning Medical Update. What it's like when a community rallies behind a patient and the first symptoms that can help you catch colon cancer early. That's Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.